Okay, so I'll share some information related to medications used in management of obesity. And keep in mind, this is just a general advice. And before taking any of the medication, always consult your healthcare provider or doctor. So, first of all, when is the medicines needed in obesity? So, American Gastroenterological Association has recently published guidelines related to medical management of obesity, and I'll try to uh, uh, give information based on that. So, one of the recommendation is in adults with obesity or overweight with weight-related complications, in whom lifestyle interventions like exercising or diet control have not been useful to manage their obesity, they can start taking medicines. And also, the management and medications of obesity are a long term uh, goal. So it's not like you will take medicines for some days and uh, effect will be observed. You have to take the medicines for a long period of time. Then only, uh, even for at least 3 to 4 months, then only some effect will be observed. So I'll just talk about some medicines now. So one of the medicine is it is actually recently came into the picture. It is semaglutide, and another similar medicine is liraglutide. So they actually delay gastric emptying. So what these medications do is that the food which is passing through your uh, gut, the stomach and the intestine, they slow down this process. So the food takes longer to pass, and because the food stays in the canal for a long period of time without getting absorbed, you may feel a sensation of fullness. So these are very useful medications. So AGA advises that these medicines should be used as first line for the management of obesity, and also they are very useful if you also have type 2 diabetes. So they have useful effects in both controlling obesity and type 2 diabetes. So as you know, as they delay gastric emptying, so side effects are very logical. It can be nausea and vomiting because the food stays longer in the gut. Also, there have been some cases of pancreatitis and gallstones associated with these drugs, so you should keep that in mind and ask your healthcare provider whether you have the chances of suffering from those diseases or not. So, if you have obesity along with weight related complications, then you should definitely, apart from lifestyle intervention, try these medicines. So now I'll tell you about a different medication. So phentermine and topiramate. So these are two different medications which are used together. Mm, alright. Yeah, phentermine and topiramate. So these are also useful medications, but these are not the first line because they have some side effects. But keep in mind, because if you have obesity associated with migraine, then you should consider using these drugs because topiramate is also useful in migraine. So obesity associated with migraine, then these drugs are useful. But if you have cardiovascular diseases, then you should stay away from these drugs because phentermine is related to adrenergic hormones and can cause increase in blood pressure and other deleterious changes on your heart. So you should avoid them in cardiovascular diseases. Yeah. Also, keep in mind that this drug topiramate can have very bad effects if you are pregnant or are planning pregnancy. So, it is generally advised that this drug should not be taken by women of childbearing age. So, caution in pregnancy. Yeah, and even if you are taking these, keep in mind that you monitor your blood pressure and other heart rate and other changes related to the heart, because you never know that these may cause deleterious changes on your heart. So now there's another class of drugs. So these are also two different drugs. You might have heard about them, and naltrexone and bupropion. So these drugs are also not first line, but they are very useful if you have obesity and you are also attempting smoking cessation. So obesity and you are obese and you are also trying smoking cessation, then they are very useful. Also, if you have depression, if you are taking an antidepressant, so keep in mind this bupropion is also an antidepressant. So if you are planning to lose weight and are also taking antidepressant, you can consider this option, naltrexone and bupropion. But caution, they should be avoided if you have history of seizures, or in your family there are risk factor for seizures, and never take them with opiates. If you are if you use opiates which are actually illegal and are not good for your health, but still if someone is using them, keep in mind that naltrexone should not be used with opiates. And sometimes people may also take opioid related pain medications, so with them also naltrexone should not be used. And keep in mind to check your blood pressure while you are taking these drugs, though they have very less cardiovascular adverse effects. So another very commonly known drug is orlistat. This is quite popular and it is an over-the-counter drug. But keep in mind that this drug is not very powerful as compared to other drugs, nor it is first line, and it only produces short-term changes and uh, not beneficial for obesity in the long term. Also, its mechanism of action is it decreases the absorption of food in your uh, intestine. So what happens is most of the food you eat is passed as stools. So you have bulky stools. So bulky stools, and because it does not allow absorption of nutrients from food, this can cause vitamin deficiencies. Okay. So this drug is not very useful in the long term. It only produces short term benefits. So these are the most commonly used drugs for obesity. There is another drug which goes by the name diethyl propion, but they should also be avoided in cardiovascular diseases. And if you are planning to take phentermine but are not interested in using topiramate, then you can use phentermine uh, alone without topiramate. But keep in mind to check your blood pressure and other cardiovascular risk factors, and uh, avoid if you have any pre-existing cardiovascular disease. So now, if sometimes these drugs don't work, and also in some cases surgery is beneficial. So the most common indications of surgery, obesity surgery, is if you have BMI greater than 40, or BMI greater than 35 plus some obesity related complications like type 2 diabetes or any other complication associated with obesity. Also keep in mind this is only general information and not health advice. So always remember to consult your healthcare provider or doctor before starting any of this medication.